The wide usage of chemicals for relief from tension and other concerns has been well documented. In a recent article, it was reported that of all the prescription medicines available in the world today, Valium leads the market. In 1974, doctors issued 60 million prescriptions for Valium alone. It is estimated that 500 billion Valium tablets will be consumed in 1976. That is 500 billion Valium tablets. No one seems to know just how this chemical works on the human system, except that it depresses a part of the central nervous system and tends to reduce the anxiety level of its consumer. There are, of course, many other such chemicals, whether they be of the prescription or over-the-counter varieties. Relaxation therapy and tension management are natural approaches to the solution of tension problems. This does not mean that tension management overlooks the value of some chemicals when these synthetic substances are consumed under the direction of a careful physician for specific medical purposes. Overuse and abuse of chemicals is common but unnecessary when individuals are willing to exert some self-discipline in the process of helping themselves. Relaxation therapy has been developed out of my clinical experience with a wide variety of patients. I have altered my relaxation procedures when I felt it was useful to do so and when I was satisfied with the final result. Relaxation therapy has been employed with patients with orthopedic problems, cardiac problems, headaches, ulcers, psychotic and neurotic symptoms, and with normal people with varying levels of tension problems. It is a natural approach to tension relief and has demonstrated its clinical relevance and effectiveness over an extended period of time and with a wide diversity of human problems. Relaxation therapy and tension management are not intended as cure-alls for the total human condition. They are basic processes of self-help that can significantly reduce and prevent a host of tension-related problems and concerns. When you do relaxation therapy, first, select a quiet, preferably dark room where you are not likely to be interrupted by noise or the activities of others. Lie on your back or select a comfortable chair and close your eyes. The prone position is an excellent position for various physical reasons. If you are comfortable without a pillow under your head, proceed without one. Not using a pillow will help you relax with your spine in a more straight-line position. Also, you may place a pillow under your knees so that your knees are arched. This takes the strain off your hips near the small of the back. During relaxation therapy, your body temperature may drop somewhat, so use a blanket or at least something to cover your chest. If you are concerned about incoming calls, take the phone off the hook. Relaxation therapy consists of 3 basic stages. The first stage consists of some basic breathing exercises that help you settle in, but also prepare you for the overall relaxation experience. It is important that you do not strain yourself during these breathing exercises. Proceed at a pace you are comfortable with, and do not concern yourself with whether you are in perfect step with the speaker. You will find your own natural pace, and this is as it should be. Don't even worry about whether you are concentrating on the tape. If your mind begins to wander from the process and you begin to think of other things, just let it do so. There is nothing you have to do. As a matter of fact, you will get better results if you don't try to relax. Let your activities be effortless and natural. During the breathing exercises, inhale through your nose and focus on the expansion of your stomach, not your chest. By expanding your stomach, you provide space for your lungs to expand into. Pulling your stomach in will reduce space within and can diminish the overall relaxation result. You will be instructed to take 5 deep breaths. You should do all 5 unless you are uncomfortable doing so because of a recent operation or some other constraining factor. Again, do not strain yourself and do not worry whether you are proceeding as you should. The second stage consists of some muscle relaxation exercises. Allow yourself to follow the line of thought of the speaker, but do not overly concern yourself with your own lack of attention. Just continue to listen to the tape without effort, and you will relax. The third stage consists of a simple meditation or dreamlike process. It takes place when you are already in a state of physical relaxation and when you can profit from allowing your mind some freedom of its own. Allow your mind to wander, and you will occasionally have memories and images that have personal significance to you. If your mental images change and seem to follow no pattern, don't be concerned. Some people develop a pattern of images and some do not. Also, some people are inclined toward the retrieval of memories and others are not. Frequently, people fall asleep during relaxation therapy and do not recall the third stage. The more tired you are, of course, the shorter time it will take for you to relax and to go to sleep. Retrieval of memories and the development of images can be very useful to you, as can the dreamlike state often observed in the third stage of relaxation therapy. If you find your memories and images uncover some uncomfortable emotions, do not worry about it. This is a positive process that represents a growing awareness of who you are, where you have been in life, and how you feel at some deeper levels. These memories are associated with feelings that you have not been conscious of. Bringing these images, memories, and feelings into consciousness is a positive process and one of growing self-awareness. Should this aspect of relaxation therapy uncover images and feelings that are conflict-producing beyond the point where you feel comfortable, you might consult a mental health professional in your area. He or she can help you to deal effectively with this side of your life and with your history. In general, most people enjoy the second and third stages of relaxation therapy and find them to have positive, interesting, and facilitating effects. You will notice that you have been provided with 6 different versions of relaxation therapy. The breathing exercises and muscle relaxation exercises are the same on all 6 sides. The third stage has 6 different variations intended to provide you with variety in your personal relaxation program. The first tape is entitled Imagination and Meditation. The primary purpose of this tape is to introduce you to the dreamlike process in a manner that is somewhat structured, but nevertheless allows you to introduce your own personal images and reflections. If you find that you do not allow your mind to wander during this time, be patient with yourself, and you will eventually derive the desired results. You may even want to continue on to the second tape entitled Gentle Rainfall. It is not essential that you like or enjoy the first tape. The following tapes contain recordings of nature sounds that are more suggestive of memories and images, and it is probable you will find these most enjoyable. Some of these programs will be more enjoyable to you than others. People vary greatly in their likes and dislikes in this regard, and it is normal you will find some of them enjoyable and others less so. I can recall one individual who, unlike most people, disliked the Gentle Rainfall version because she had grown up and then left her native country of Scotland because of the rain. Rainfall was not an enjoyable sound or memory to her. The last tape is called A Quiet Place. On this tape, there are no sounds to suggest imagery. You should do this tape last because it is, in some respects, more difficult to allow your mind to wander in the absence of the suggestive sounds of nature. Let your own experience with the tapes be your guide, and you will find yourself using some more than others, and perhaps some not at all. Again, remember, there are considerable differences in how people react to the tapes in terms of their personal preferences. Your attention management text contains questions and answers commonly asked by those who have experienced relaxation therapy. You may want to look through this section of the book if you are curious or apprehensive. For example, you may wonder if it is possible to relax too deeply and not wake up on your own. The answer is no. Your body has its own regulatory system. You will not relax too much, and you will wake up when you are ready. Relaxation therapy is an important cornerstone for an overall approach to tension management, but it is not the complete program. It is through results of relaxation exercises that you become more fully acquainted with how it feels to be relaxed and how you can achieve this state of inner balance. In addition to relief from tension that accompanies relaxation therapy, knowledge is gained regarding how a state of relaxation can be generated during times when it is not feasible or possible to use the tapes. Once you have developed an ability to establish inner quiet, this skill may be applied to virtually any situation you may find yourself in. A complete program of tension management requires more than the ability to relax. It is important that each person become acquainted with his environment and how environmental circumstances affect emotional states. Awareness of the effects of external events like noise pollution is an important aspect of tension management. It is essential to tension management that each participant in the program develops the ability to identify those aspects of his environment that are uniquely tension-producing for him. When, through the study of relaxation, you become more sensitive to tension within your own body, you are in a better position to identify your own tensions and their causes. States of relaxation and tension are experienced very differently, and it is through awareness of the contrasting differences between these two physical conditions that we develop the ability to identify factors that lead to each. Many people are accustomed to living at a high tension level and forget, or perhaps never knew, that life can proceed in a relaxed, balanced, and pleasant manner. These same people will usually announce their tensions when they have reached such a state of discomfort that their feelings demand conscious attention. The "I really need a drink" phenomenon is a common example of someone whose tensions are truly getting out of hand. Frequent consumption of tranquilizers is another conventional method for the handling of unmanaged tension. It is normal that unless you are aware of the presence and the accumulation of tension, these inner pressures will mount and eventually require some form of attention. The common practice of taking liquids and capsules to relieve tension represents a cultural tendency to resolve emotional conflicts through chemical agents and external means. This method of coping is not a successful one in the long run, and the drug-dependent individual will pay a penalty for not taking time to learn other methods for handling conflict. It is important that we learn to identify tension-producing events in our lives and that we develop an increased capacity for handling this tension in a self-directed and natural manner. Have you ever asked yourself what this nationwide process of sedation is all about, how it came into being, and how it may be affecting you? Personal surrender to advertising and to its directives to take something to relax may very well account for a large portion of our abdication of responsibility to take good care of ourselves. Awareness of how you cope with stress and tension will reveal your own approach to the handling of conflict. Awareness of what produces tension in you will reveal environmental and interpersonal stimuli that trigger tensions in your personal life. Learning how and when to relax will serve you in your quest for personal control over your own sense of being. Relaxation skills, in conjunction with an enhanced awareness of tension-producing stimuli, will facilitate healthier and happier personal functioning. The achievement of inner peace, interpersonal harmony, and the acceptance of personal responsibility for your own destiny will contribute greatly to a balanced way of living. Tension management is thus a program designed to provide you with mechanisms and with knowledge that can help you help yourself. Tension management is also a program that helps you focus on you and what you are doing. It is relatively easy to deceive ourselves into believing everything is all right and that nothing further is required of us beyond that which we are doing. However, if most of us would take a close look at our own behavior, we would most likely see things we would like to change. When we believe we have the ability to change and that these changes will generate positive outcomes, we can alter the course of ongoing events if we are willing to exert a measure of self-discipline. Tension management is for people who are willing to put forth effort to help themselves, and not for those seeking quick cures and easy solutions to life's inevitable challenges. Helplessness in the face of destiny is for those who discredit themselves and their resources for building a better life. Tension management is for those who still enjoy the challenge of living and who are willing to pursue that challenge with energy, patience, and personal responsibility. Personal effectiveness in your future will be increased or decreased in relation to what you do for yourself.